The Bill and Melinda Gates Foundation spends tens of millions of dollars per year on media partnerships, sponsoring coverage of its program areas across the board. Gates funds The Guardian's Global Development website. Gates funds NPR's global health coverage. Gates funds the Our World in Data website that is tracking the latest statistics and research on the coronavirus pandemic. Gates funds BBC coverage of global health and development issues, both through its BBC Media Action Organization and the BBC itself. Gates funds World Health coverage on ABC News. When the NewsHour with Jim Lehrer was given a $3.5 million Gates Foundation grant to set up a special unit to report on global health issues, NewsHour communications chief Rob Flynn was asked about the potential conflict of interest that such a unit would have in reporting on issues that the Gates Foundation is itself involved in. In some regards, I guess you might say that there are not a heck of a lot of things you could touch in global health these days that would not have some kind of Gates tentacle, Flynn responded. Indeed, it would be almost impossible to find any area of global health that has been left untouched by the tentacles of the Bill and Melinda Gates Foundation. It was Gates who sponsored the meeting that led to the creation of Gavi, the Vaccine Alliance, a global public-private partnership bringing together state sponsors and big pharmaceutical companies whose specific goals include the creation of healthy markets for vaccines and other immunization products. As a founding partner of the alliance, the Gates Foundation provided $750 million in seed funding and has gone on to make over $4.1 billion in commitments to the group. Gates provided the seed money that created the Global Fund to Fight AIDS, Tuberculosis, and Malaria, a public-private partnership that acts as a finance vehicle for governmental AIDS, TB, and malaria programs. When a public-private partnership of governments, world health bodies, and 13 leading pharmaceutical companies came together in 2012 to accelerate progress toward eliminating or controlling 10 neglected tropical diseases, there was the Gates Foundation, with $363 million of support. When the Global Financing Facility for Women, Children, and Adolescents was launched in 2015 to leverage billions of dollars in public and private financing for global health and development programs, there was the Bill and Melinda Gates Foundation as a founding partner with a $275 million contribution. When the Coalition for Epidemic Preparedness Innovations was launched at the World Economic Forum in Davos in 2017 to develop vaccines against emerging infectious diseases, there was the Gates Foundation with an initial injection of $100 million. The examples go on and on. The Bill and Melinda Gates Foundation's fingerprints can be seen on every major global health initiative of the past 2 decades. And beyond the flashy multi-billion-dollar global partnerships, the foundation is behind hundreds of smaller country and region-specific grants, $10 million to combat a locust infestation in East Africa, or $300 million to support agricultural research in Africa and Asia, that add up to billions of dollars in commitments. It comes as no surprise, then, that far beyond the $250 million that the Gates Foundation has pledged to the fight against coronavirus, every aspect of the current coronavirus pandemic involves organizations, groups, and individuals with direct ties to Gates funding. From the start, the World Health Organization has directed the global response to the current pandemic. From its initial monitoring of the outbreak in Wuhan and its declaration in January that there was no evidence of human-to-human transmission, to its live media briefings and its technical guidance on country-level planning and other matters, the WHO has been the body setting the guidelines and recommendations shaping the global response to this outbreak. But even the World Health Organization itself is largely reliant on funds from the Bill and Melinda Gates Foundation. The WHO's most recent donor report shows that the Bill and Melinda Gates Foundation is the organization's second largest donor behind the United States government. The Gates Foundation single-handedly contributes more to the World Health Body than Australia, Canada, France, Germany, Russia, and the UK combined. What's more, current World Health Organization Director General Tedros Adhanom Ghebreyesus is in fact, like Bill Gates himself, not a medical doctor at all, but the controversial ex-Minister of Health of Ethiopia, who was accused of covering up 3 cholera outbreaks in the country during his tenure. Before joining the WHO, he served as chair of the Gates-founded Global Fund to Fight AIDS, Tuberculosis, and Malaria, and sat on the board of the Gates-founded Gavi, the Vaccine Alliance, and the Gates-funded Stop TB Partnership. The current round of lockdowns and restrictive stay-home orders in Western countries were enacted on the back of alarming models predicting millions of deaths in the United States and hundreds of thousands in the UK.
Imperial College in London released a COVID-19 report, and that's where most of our U.S. leaders are getting the information they're basing their decision-making on. The report runs us through a few different ways this could turn out depending on what our responses are. If we don't do anything to control this virus, over 80% of people in the U.S. would be infected over the course of the epidemic, with 2.2 million deaths from COVID-19. That 2.2 million deaths also doesn't account for the potential negative effects of health systems being overwhelmed.
From this evening, I must give the British people a very simple instruction. You must stay at home.
Enough is enough. Go home and stay home.
A statewide order for people to stay at home.
The work of two research groups was crucial in shaping the decisions of the UK and US governments to implement wide-ranging lockdowns, and, in turn, governments around the world. The first group, the Imperial College COVID-19 Research Team, issued a report on March 16th that predicted up to 500,000 deaths in the UK and 2.2 million deaths in the US, unless strict government measures were put in place. The second group, the Institute for Health Metrics and Evaluation in Bill Gates' home state of Washington, helped provide data that corroborated the White House's initial estimates of the virus effects, estimates that have been repeatedly downgraded as the situation has progressed. Unsurprisingly, the Gates Foundation has injected substantial sums of money into both groups. This year alone, the Gates Foundation has already given $79 million to Imperial College, and in 2017, the foundation announced a $279 million investment into the IHME to expand its work collecting health data and creating models. Anthony Fauci, meanwhile, has become the face of the US government's coronavirus response, echoing Bill Gates' assertion that the country will not get back to normal until a good vaccine can be found to ensure the public's safety.
If you want to get to pre-coronavirus, that might not ever happen in the sense of the fact that the threat is there. But I believe with the therapies that will be coming online and with the fact that I feel confident that over a period of time we will get a good vaccine, that we will never have to get back to where we are right back now.
Beyond just their frequent collaborations and cooperation in the past, Fauci has direct ties to Gates projects and funding. In 2010, he was appointed to the Leadership Council of the Gates-founded Decade of Vaccines project to implement a global vaccine action plan, a project to which Gates committed $10 billion of funding. And in October of last year, just as the current pandemic was beginning, the Gates Foundation announced a $100 million contribution to the National Institute of Health to help, among other programs, Fauci's National Institute of Allergy and Infectious Diseases research into HIV. Also in October of last year, the Bill and Melinda Gates Foundation partnered with the World Economic Forum and the Johns Hopkins Center for Health Security to stage Event 201, a tabletop exercise gauging the economic and societal impact of a globally spreading coronavirus pandemic.
It began in healthy-looking pigs, months, perhaps years ago. A new coronavirus.
The mission of the Pandemic Emergency Board is to provide recommendations to deal with the major global challenges arising in response to an unfolding pandemic. The board is comprised of highly experienced leaders from business, public health, and civil society.
We're at the start of what's looking like it will be a severe pandemic. And there are problems emerging that can only be solved by global business and governments working together.
Governments need to be willing to do things that are out of their historical perspective, or for the most part, it's really a war footing that we need to be on.
Given the incredible reach that the tentacles of the Bill and Melinda Gates Foundation have into every corner of the global health markets, it should not be surprising that the foundation has been intimately involved with every stage of the current pandemic crisis either.